because attendance, Dr. Brown is monitoring attendance this week as well. So tonight we're going to do our HESI review. I don't think it'll take all class. I'm going to go over the main topics the best I can with you. HESI covers a great deal of information. My thoughts and suggestions to you is this: if you've done well up to this point, you're probably halfway there for HESI. So good work on that. We help to write HESI questions on and off, but not all of them, of course. We don't know what version you'll get. There was a conversation about next gen questions. What I will tell you is that take those questions on the test. I don't know. One of the students mentioned that they thought next gen was a test and those questions won't be counted. I am not aware of that. So I need you guys to take the test as if every question counts, okay? And it's possible that we'll have something else come up where they don't count, but as far as I know, every question will count on the HESI. I want to congratulate all of you guys. This class did amazing on exam number 3. I had several A's, so you guys prepped well and you were prepared, and I was happy to see that. Anybody who wants to go over exam 3, I'm free. Just send me an email and I can go over that with you. Next week, we'll have our HESIs. Everybody should be signed up. And good to go. If you have any questions about where it is or what time it is or whatever, make sure that you guys have contact with your deans, okay? Because they really regulate HESIs. Vulnerable Populations Project, great job out there for most of you. There were a couple that didn't really follow the rubric, and so those were a little hard to grade, but what I will tell you is you guys' effort was noted. Thank you very much. I like learning about all the different populations that you guys are around, so that was interesting for me. Any questions out there about grades, about what's going on, about anything is that's the benefit for the whole class? No, we're all good. Everybody ready to be done? Yes, I hear you. I know it. So it's okay. We're going to do our very best. We're going to review the best we can. And I want you guys studying your NCLEX book for community. It's blue, greenish. So we'll be using those as review questions. I mentioned to another student as well that there's questions in your book, like test questions. You can take quizzes for each chapter. That's another way to study the content. Okay, so if anybody has questions about that, that's where you'll find it. So we're going to start tonight. I'm going to do a PowerPoint with you for HESI review. I have a Kahoot scheduled, and we have some Excel spreadsheet that has some topics on it. And those topics have been identified to us as professors as information you guys need to know for the HESI. Okay, so try to do that. If you're visiting, you'll be on my Excel spreadsheet, so I will pass that along to professors as well. But I am telling you guys, please make sure you're attending your regularly scheduled class this week. I sent out an announcement as well, week 12. Everybody needs to set up an appointment with me to go over grades. So please make sure you do that. That is how we will account for attendance on week 12. So any questions about that, review the announcement. I'm trying to come up with a way to do a calendar where you guys can just sign up, like a Google Doc calendar, but I haven't been very successful. Anybody have tips on how to do a shareable calendar?
One of our PEDS teacher did something doodle, and it worked out pretty good. Yeah.
Let me write that down. So I'll do some work. I'll do some work and some research and see if I can come up with one. If not, I expect an email. I have already had several students email me with times, and you guys are all set if you emailed me. So pick a time. It'll really be during our class that week 12. And we go over, there's also a sign up genius. That's a good idea. I know how to do those. All right, let me see if I can do a sign up genius tonight, and I'll send it out to everybody if I can. And if I can't, I'll touch base with you guys this week and let you know what I'm doing. All right, so we're going to take a look at our PowerPoint. You are welcome to attend anyone's HESI review this week. If you want to get someone else's input on HESI, that's always a great idea. Okay, so the PowerPoint we're going to all look at. I cannot share, as you guys know, PowerPoints that are not with the book. So this is one that was made up by me and another professor just to guide us a little bit. So we're going to take a look at our PowerPoint. And hold on. Oops. Guess it didn't want me to share the PowerPoint. Alrighty, here we go. Here is our review, and we will start there. So it's going to be a review of a lot of stuff we've done in class. So I want you guys to just sort of follow along, and I'll be asking you questions as we go, just to make sure everybody's with us and not sleeping. Alrighty, so we have, first slide is going to be about our public health. What is public health and what is our philosophy? We look at health and longevity as a birthright, so we're going to promote that for everyone. Our objectives with our Healthy People 2030, remember, is prevent disease, prolong life, and promote health and efficiency through a community effort. With public health nursing, we know that we look at social assistance as well. So sometimes we pull in social workers to help us with promotion of health, improvement of physical and social environments, rehab, and prevention of illness and disability. When we look at collecting data, this was a question on your test, this last test. Remember that our primary goal of data collection is to get useful information about the community and its health. Systematic collection, we look at existing data, we look at what's missing, what does this tell us, and how is this identifying our health problems? So one thing to remember is on our test, there was a question, does anybody remember? It was about, what do you need to do before you do a community assessment? What must you establish first or know first?
Their boundaries.
Yep. You need to know boundaries, right? And that was important on our test. So you want to know the boundaries before you can even determine what you're teaching, right? Or data you're collecting. So if you're looking at a community and collecting data, you're going to be doing that with interpretation. When we look at data gathering, it's our process of getting info that we already know. And so we look at our age, our gender, socioeconomic, racial, vital statistics, community institutions, and personal characteristics. When we look at data generation, it's developing data that we don't have already, so we're generating it. We're going to know it's about type of information that's kind of hard to figure out. So our values, our goals, norms, problem solving, who's in leadership, and what's influential when we look at that. All right, so we have our primary, secondary, and tertiary. Our primary, we know, is educating about what's going on. Can someone give us an example, 2 examples of primary?
Vaccinations and education.
Good. And education, what do we have to be careful about? Who are we educating? Are we educating sick people or healthy people?
People that haven't been diagnosed.
Yep. So they don't have anything wrong with them. So be very careful with your primaries. Vaccinations, you're always going to see as a primary. Then we have our screenings, our secondary, where we have local health departments, clinics, and our rural health nurses that do some screening. Some examples of screenings, just shout them out.
A TB skin test.
TB.
Yep, TB. What else?
Mammogram.
HIV.
Yep. Our visits to our primary care physician when we do our yearlies, there's a lot of screening that goes on there. What kind of screenings do they do when you go for your yearly checkup?
Like pap smears?
Pap smears, yeah.
Lab work.
Yep.
They do a lipid panel.
Yep. Blood pressure screenings, right? They do your weight, so they're doing your BMI screenings, right? Those kind of things. Good. Then we have our tertiary, and that's always when we have some disease process or some problem going on. So we see rehab, we see specialized care, healthy, highly trained personnel, sophisticated equipment. Give me some examples of tertiary prevention.
Physical therapy.
Okay, physical therapy if somebody's injured, yes.
Diabetes.
Glucose monitoring.
Yeah.
Glucose monitoring is dependent, but let's make sure it's only on our diabetics, right? Because if we do a blood sugar screening on a healthy individual, that's our secondary, but good. Glucose monitoring, what else?
Maybe wound care.
Yeah, absolutely. Treating a wound.
Counseling.
Counseling?
Yeah, counseling.
Mhm. Yeah, how about with our addicted community? What kind of tertiary things would we see?
Support groups.
Like,
Support groups,
Rehab?
what else?
Reduce risk.
Yeah, we're gonna do risk assessments, right, to see who's at risk. That'll be our secondary screening, but we're gonna try to help them with their harm reduction, I think is what Esther's talking about, which is good. That's good.
Yes,
We're
ma'am.
gonna-
That's exactly what I'm trying to do.
Yep.
Yeah.
Yep, good. Exactly. You're right. You're right. So you want to reduce those things that put them at risk. We're going to look at that environment. Which healthcare system is going to pay for things like activities of daily living, diaper changes, babysitting? Medicare or Medicaid is going to cover that.
Medicaid.
Yep. Yep. Medicaid may. But we know Medicare, it has to be skilled, right? Something
Skilled
skilled. So it's
nursing.
got to be that wound care treatment. It's got to be something really important. So we're not able to hire. So think about that when we're thinking about those things. With tertiary care, you want to think of clinics, hospitals, because that's usually where you're treating people, right? And we've spoken quite a bit about health promotion. It's our process of enabling people to increase their health, improve their health. Gosh, I can't talk tonight. An approach to wellness. Okay, and then we also have our environmental pieces that we look at. We're looking at home radon testing. We're looking at, are they in a basement? Do we have lead? That's our big one with kids. What is the year for a house in lead?
60s.
Keep going.
Is it lower than, oh God.
Was it 1978?
Yeah,
It
that's
sure
what I thought.
is.
It's lower, yeah.
Yep. 1978, we know they were still using lead-based paint. Okay, so we want to always investigate though. Good. Heating sources, like are we having gas leaks? Are we having our vented dryer and hot water heaters, gas stoves, our lead pipes, our water? What do we worry about water?
Temperature.
Contamination.
Yeah.
Yep, you got temperature, you got contamination. What else do we worry about? What's one source of water that there's a lot of worry about? You see it more in rural communities.
well,
You got it, the wells. We worry about our well water, right? Smoke detector, carbon monoxide, make sure you have those, fire extinguisher, disaster plans. This was on our test, and we know that we always have a kit that we're gonna get ready. What do we do with that kit? What's in the kit?
Food enough for 3 days.
Mhm. Yep, what else?
Flashlight,
Yep,
Batteries.
Utility.
water, battery radio.
yeah, battery powered radio, good. Remember, we're gonna pack some meds in there, just in case. Little extra meds so that we have them if we're stuck and we can't get to them. All right, we take a look at infectious disease. You are going to need to know about several different infectious diseases. I don't know exactly which ones. We'll go through a few. You're going to need to know about their incubation periods, and you guys did some research on infectious disease. I will focus you on your studies, but please be very familiar with your infectious diseases and their periods of time. We know that with infectious disease, we have this epidemiological triangle. If you guys remember, we did some work on this. We know there's 3 parts to it: our environment, our agent, and our host. Our agent and our host, you know, are usually balancing on our environment. So how do we change things? What is the association between all 3? What can we
Go
change here?
together.
What of our 3 things can we change? Okay, so I'll give you an example. With COVID, I want you to think about this. Can we do anything about the COVID virus?
No.
Can't alter it. You
No.
can't capture it in a tube and shake it up and remake it, right? So a lot of times you're gonna have a harder time with your agents changing those. Radiation, can we change radiation?
No.
We can try to stay away from it, right? But we need radiation for tons of things in the world. So think about that. Can we change someone's environment?
Yes.
That's our, as a community health nurse, of course, we're gonna help work to get that environment up to par. There, we have some health disparities and we have things that impact people's environment. What do we remember about poverty? What do we see?
Diseases.
More health issues.
Yeah, we see higher health issues. Remember with our homeless population where they're going to the ERs and getting their services to them? What do we see with our homeless? Do we see more acute or chronic with them?
Chronic.
Chronic.
Good, because they're not going to see that doctor and they may not know about it. This is where we're going to do some prevention. What are some levels of prevention for primary prevention we can do with our epidemiological triangle?
Vaccinations.
Tell me a little bit more. You're right. Where's the vaccine? Who's getting the vaccine?
The host.
Yep. Our people are getting the vaccine. What does
Yeah.
that do once they get the vaccine? It gives them some immunity potentially, right? And so then we can alter this triad so that we can make our host less vulnerable, right? And with our environment, we're going to be using all our resources with our homeless, with all our vulnerable populations, right? We're going to make sure that we're giving them all the resources so they know how to use that. Primary prevention here would be a vaccine will change our host. Think about a secondary prevention that we could use with this triangle.
Screening?
Good. Tell me more.
Like a flu test,
The flu what?
like a test to see if they have the flu.
Yeah, we could screen for the flu. We could do a flu swab. Think about something like a mammogram. What's our agent with our mammograms?
Radiation.
You're going a different avenue here, but I want you to think about why we get the mammograms.
Cancer.
Yep, right? We have cancer here. If we screen them, aren't we going to see a better outcome with our triangle?
Yes.
Because you
Doesn't
catch it
mean that they're
early.
not going to have cancer. Doesn't mean, and if they're in an environment where they're able to get these mammograms and these screenings, isn't that going to improve the way the three of these pieces interact? Yeah. Our tertiary, when we're using treatment, people have already been exposed. They're in an environment that's made them vulnerable, but we can certainly make them a stronger group, right? All right, so here's some infectious diseases. Like I said, we're gonna have a bunch on there, but let's talk a little bit about our vaccines. I think the next one, yeah, our immunizations, right? We know we have one for the flu. We have treatment for the flu. So I want you guys to remember our Tamiflu. Remember, we take that 10 days. And that can help us. We have our childhood diseases that as a school nurse, we are going to remember. Which ones are they?
Measles, mumps, rubella,
Yep,
pertussis.
yep. What's
Chickenpox?
Tdap? Anybody remember Tdap?
Isn't that the pertussis one? For pertussis?
That's
It is, it's something
tuberculosis.
else in there. There's something
Tuberculosis.
else.
Tetanus and diphtheria.
Tetanus. Tuberculosis.
Tetanus, dyspharia.
Right. When are we gonna worry about tetanus? When do we worry about this one?
If they
Why would we worry that if
nail.
somebody wasn't vaccinated?
They can get lockjaw.
Good. Tell me, how would they get lockjaw?
If they get step on a rusty nail or get
Mhm.
cut with something that's rusty.
Yep, dirty metal.
Yeah.
Good. We have our Hib and our Hep B as well. With our adults, remember we do our shingles. So that's important to remember. Here's some, our vaccine reporting system known as VAERS. Remember, it's a national vaccine surveillance system, and it helps see if something went a little awry with vaccines. If anybody got the COVID vaccine, which I think you guys all had too, but I don't know, a couple quarters ago, you guys all had to have them. But anyway, we had that thing where you would get a text on your phone and it'd say, fill this out. What was your reaction, right, to COVID, the COVID vaccine? So it's just really a reporting system. It's passive surveillance. Remember, we have passive and we have active. What's the difference between passive and active?
It's passive when the providers report it,
Mhm.
their findings, and then active is when we report it to the doctor.
No, it's not that we report it, we go out and find it.
Go out and find it, okay.
Okay, so take a look at this. This system is a passive surveillance system because, as you guys know, you had to report it on your phone. Nobody was getting phone calls from the doctors, right? If we see a pattern of adverse events, you know, with a vaccine, we look for some studies to do some research. I think they're probably doing that now with our COVID. We look at flu. Our incubation time is going to be 1 to 4 days. We have anthrax, a 1 to 7. Our TB, we're going to talk about TB real quickly. How do we screen for TB?
Tuberculin test.
Okay, so what if the test comes back positive?
X-rays.
Chest X-ray.
X-rays, chest X-ray. What, why could be a reason that you come back with TB positive skin test?
If they've had the vaccine.
Yep, or any exposure may come back that way, right? And then we have SARS, which is our 2 to 7 days. SARS we know about, we just went through COVID. We're still going through COVID. I don't know if anyone's seen a rise, but there's a rise going on right now. And it's a different version, of course. So vaccines are helping, but we're trying to get ahead of it as a society. So we know it's cough, shortness of breath, loss of taste and smell, transmitted respiratory wise. Influenza A and B, another big one that we're coming to the end of flu season right now. We have fever, chills, muscle aches, headache, tiredness, congestion. Usually clears up within 2 weeks. Can be deadly for our compromised people. What else can be deadly for our immunocompromised people?
Everything.
Everything. How about water? Remember your contaminated water? It's really going to impact those people because they can't fight that off. Okay. So we have treatment for flu, vaccine, antivirals. We try to be prophylactic, but sometimes it doesn't work. Here's a nice little picture of pneumonia. Here's our TB skin test. So we talked about that. Lyme's is one of our vector-borne. Remember, it's with our ticks. Where do we see ticks?
The woods.
Yeah, wooded areas. So our symptoms, fever, headache, and this is often underdiagnosed. So if you have a patient that you think is something's going on, but you can't quite figure it out, it never hurts to test them for Lyme's because a lot of times they won't even know they were bit by a tick. Okay. Who do you think is going to be vulnerable for Lyme's? What group of people?
People in the rural areas.
Good. Who else?
Woods, in the woods.
People that like to camp.
Good. People who like to camp. I don't know why anyone would camp, but yes, there's lots of people that like to camp. So we're going to look at those things. So when we are assessing our patients, we're going to say, where'd you go on vacation? Or what have you been up to, right? There's a big movement right now. People are buying those big old things that they drive around the country and then they park and camp in those. So we want to be real specific. Untreated, this can be deadly. So it'll impact our heart, our joints, our nervous system. Careful with that one. Another one is our Rocky Mountain spotted fever, another tick-borne illness. We see it with the Pacific Coast tick, and we have treatment that can be done for it, but something that has come back up again. And so all these illnesses, they go away a little while and then they come back again. But if you've been watching anything in the news, you know that this is back on monitoring. Takes us into our STDs, right? What do we know about STDs?
Syphilis can cross the placenta.
Yes, you got that question right on the test. Good. What else do we know about our STDs?
They're cured with antibiotics.
Can be.
Bacteria.
They can
And they can be prevented if they use condoms, for example.
Yep. What are we going to be teaching about condoms when we're doing sex education to any community? Are they 100% guaranteed?
No.
But they are one of our best preventative measures, okay? So we need to know about that. Be careful about some with teenagers particularly. There's a lot of stuff going around. I don't know why, but teenagers now are having multiple partners at the same time. That's like a trend right now. We're going to be really careful with that because we do know that male to male transmission is going to be higher on our STDs oftentimes. We know that some are bacterial and we can treat them with antibiotics. We know some are viral and we have antivirals, but not all of them are curable, right? Okay, so that's our STD little talk there. Community assessment. We talked about this a little bit. What is our role? We're going to look at patterns. We're going to look at trends. This is going to be universal across community nursing. You're always looking for a pattern or a trend, okay? We look at risk finding. We talked a little bit about that with addiction. We're going to have agencies that help. We're going to remind ourselves, what's an eco map? I know, this is like beginning of the quarter. Long time
Is it
ago.
like the family one, the one that you have in the family?
You're close. You're close. That's the other. That's the genome map, genetic map. Remember, our eco map is what?
The environment or community?
Yeah. Right. Good. Who are we around? Do we go to church? That kind of stuff, right? Do we go to Bible study? Do we eat at a community gathering? Right? What do we worry about at our community gatherings?
Illnesses.
Good. Give me more.
Food poisoning.
Yeah, absolutely. Food poisoning. Because there's a ton of food out. What else? Think about it. You're around a big group of people. What kind of things are you going to be vulnerable for?
Flu, COVID.
Yeah, all our infectious diseases, right? Flu, COVID. You're not going to get a lot use being in a community group, but careful with our food preparation because that's how we have our outbreaks, which was a whole big section we did. All right, when we're looking at our community assessment, we look at the entire community, everything going on there, right? Peds, big thing here. School nurses look at this all the time. I hate lice, but being a school nurse, that's something I had to swallow. So you're going to be looking for those kind of things. What's that? Uneven shoulders, curve in the spine, uneven hips.
Scoliosis.
Yippers. What level of prevention do we do as school nurses with scoliosis?
That's screening, right? That's secondary.
Secondary.
Yep,
That was
yep.
the most uncomfortable screening I remember ever doing in school.
Well, and so it's good though, because we screen young. So we see at 8 or 7 or 8, we're picking it up. We worry about our kids and lead poisoning, right? We're checking the paint or they eating the floor, or they licking whatever. Eczema and psoriasis, you'll see skin conditions across the board with peds. So just to know that both of these are treatable usually with the dermatologist, and you may give meds for it. Common complaints, stomach ache and a headache. What do we know oftentimes these are complaints about?
Stress.
Anxiety.
Stress, anxiety, math class, reading, whatever, test taking. So you see a lot of that. So it's a little unusual in school nursing to see among a healthy population of kids to see something really wrong with the stomach. And so we kind of call stomach aches benign is the word that we use, because oftentimes they're just, the kid hasn't eaten, the kid ate something they didn't like, they had too much sugar last night, they didn't sleep. What's something else we think about when a kid comes in with aches and complaints, like minor aches and that we should think about?
Abuse.
Absolutely. We always think about abuse. So with our stomach aches and our headaches, sometimes we'll find that there's maybe an abuse that the kid is struggling with emotionally. And so we're going to do our therapeutic communication, of course, and talk to them. Our teens, this is a big old population we got to worry about. So mental health needs is on the rise. Everybody knows this. Substance use, we talk about smoking and nicotine. What are we going to do with smoking and nicotine?
Educate them,
Yeah, about what?
the harms it can do to your body.
Yeah, it's not great for you. What else are we going to do?
You can educate them on the use of like vapes, because I know that's a big thing now.
Mhm. What do we know about vape oils for kids?
They're poisonous.
Good. Our STDs, I talked to you guys about that. Teens and our unintended pregnancies. Who is our high? It was a very high risk group among our teens.
Homeless,
Homeless what?
homeless teens that were pregnant, that were like having pregnancies or had kids already.
What is our goal with them?
Help them
Education.
complete like high school, get a degree.
Because what do we know about education and poverty?
They go hand in hand.
Mm-hmm. Yep. So lack of education causes an increase in poverty. Our motor vehicles, unfortunately, we see a lot of these suicides at this age. So we want to really promote therapeutic communication among kids this age. Sometimes you need to be that nurse that really cares for them. I just read a study today on the outcome of type 1 diabetics with their school nurses. And what they have found is the better the relationship with the school nurse and the student, the better the blood sugar consistency is throughout the day. So your impact is huge with this group. So really want to be a friend to them, so-called, a supervising friend. Okay, so you really want to be therapeutic with them. We talked about healthy people, 2020 and 2030, alcohol, drugs, and tobacco. We know violence. One of the questions that was hard on your test that I want to go over with everyone is domestic abuse. So with domestic abuse, it has been found, and this will probably arise on your HESI. What do we know about domestic violence?
It reoccurs.
We often see a pattern. It's a cycle, right?
If
What
someone
else do we know about it?
if a woman like reports it, like I think it's death is more likely to occur if like a woman has already reported it, or a
Isn't it
woman or
most
man.
deadly when she's establishing to leave? Like when she actively tries to leave?
Well, so I don't know that as a fact. What I do know as a fact is that the chance of an abuse to reoccur and to get more severe as time goes on is very common. So that's what you're saying, Anna, pretty much is.
Yeah, and I was also, that popped the question, what was the answer for that one? Because it's like, what was more likely to cause her to die? I think I chose having a gun in the house.
Yeah, so a lot of people did, but it's not the gun. And the way I like you guys to think about this is, and you don't need to share, and please don't disclose if you don't feel comfortable, but does anyone know someone who owns a gun in their house? So I do, because in the state of Colorado, it is free to carry a gun. Okay, so you take a class, you can carry the gun on you. So because of that, neighbors and, other people that I know carry guns around. That doesn't make them more vulnerable for abuse. Because we tend to make a parallel with guns and violence, which is true, but not domestically. Okay, so the answer for that was previous abuse in the relationship. Okay, so it's a cycle, we know that. I just talked about why it's important for adolescents. Oh, we look at diets. Okay, we want to know our heart healthy diets. What's that going to be?
Low fat, low salt.
Yeah, what are some blood work we're going to do to see if they need to be on heart healthy?
Triglycerides.
Yeah, triglycerides, what else?
LDLs.
Yeah.
HDLs, remember which one should be high and which one should be low?
Yeah.
We know that we follow the food pyramid sometimes. It's a good visual for people. Stress in the relationship with diets. We know that there's two types of stress in the world. We either have acute, which is happening and it ends, or we have our chronic, which is continuously going on. What we see with chronic stress, like nursing school, you will have increased appetite and you'll look for high fat, high sugar foods. So always going to happen. And so in nursing school, that's why people will be eating during class half the time. It's high stress. It's a way to function with it. What we see with the acute stress is you have that flight or fight response. You don't know what to do. Your suppressed appetite and hunger is just not a priority. So I will give you an example for you to remember this. And unfortunately, it's a personal example. My mom was diagnosed with cancer. When she was diagnosed, food was the last thing I cared about. So I am a type 1 diabetic, and I bet I barely ate 500 calories a day because that stress, that worry, that concern, that like I gotta, gotta make it work, right, wasn't there. So that's why people you will see oftentimes will lose weight when someone's sick around them and things like that. So keep that in mind when we're looking at diets and stress, okay? We look at coordination and care. Sorry, the picture's kind of blurry here. We know our care coordinators, do they work autonomously or they work as a team?
As a team.
It's a trick question. They do both. So they're going to work autonomously with a team, right? Because they do a lot of work maybe outside of the home, inside their home, out in a telehealth setting maybe, but they're going to be coordinating care with everybody else. So is it fair to share information? As a care coordinator, can you share information?
With their providers.
Depends on, I was gonna say, it depends on who you share it with.
Right, yeah, good. You're not going to share it with your friend, but you're certainly going to share it with the provider, with the therapist, with whomever is in the home, right? Geriatric health. Okay, so we're going to do skin health with them. What do we worry about with older people?
Pressure.
Pressure ulcers.
Yeah, we're going to be looking for ulcers. What else are we going to looking at on their skin?
Dry skin.
Yeah, moisturizing skin,
Bruising.
bruising. That's a clue for what?
Abuse.
It's good you're answering me. You're the only one answering me. No, I'm glad at least somebody's answering me. Think about these people have been out in the sun for a long period of time. What are we going to worry about with their
Skin
screening?
cancer?
Yes. You got to look at those moles and stuff. Make sure they're going for their skin checks. Endocrine, we see diabetes with them. What are some things we think about with diabetes?
Is it their feet?
Yeah, it could be their feet. What else?
In general, they have poor wound healing.
Yep. What other body part do we worry about?
Their eyes.
Yeah, their
Yeah.
eyes.
Eyes, good. We're gonna send them to a glaucoma specialist, right? If they have glaucoma. We also worry about their feet. What do we worry about with their feet?
Neuropathy.
And what is neuropathy gonna do to their feet?
They won't be able to feel anything.
Pressure sores.
Mhm. Yeah, they could step on something and have no idea they did,
Ulcers. Yeah.
Right.
right? We see a
They
lot
have
of
stabbing pain.
infection. Huh?
I was just saying with that, they get very stabbing pain.
Yeah, pain. But we
Like
also see a lot of
like-
infections in
like
the feet.
needles.
Mhm. Do you guys remember why we see infections in the feet?
Poor circulation.
Could be poor circulation. Also, a lot of times we're gonna see something go on with the toes. What do we see with the toes?
Gangrene.
Loss of
Yeah, we could.
sensation.
From what?
See.
Poor management of diabetes.
Could be.
Diabetic ulcers.
Could be. Remember their toenails. It's a big one. They should be getting them either manicured or cut by a provider, because the older they get, the harder the nails get. And what we end up seeing is infections of the toes too. So keep that in mind. Always worry about renal as well. Anything with small vessels and diabetes we think about. With exercise, what kind of hydration are we going to be promoting?
Plenty of water.
With exercise, yeah. Increase hydration, I guess.
Yeah, but we're not going to be recommending to our kids, like our sports players and stuff, the Gatorades and the high sugars, right? We're going to be promoting water. If they won't drink water, can you add something to water so that they'll drink it? You know, you can encourage them to get a flavor. There's all those flavors out for water now. Make sure if we're dealing with a diabetic, it's sugar-free, like a Crystal Light or something. Respiratory or COPDs, with our older people. Who's going to be vulnerable for COPD if you're old?
Smokers.
Or smokers.
Yeah, what else?
Obese people,
What?
people that are obese.
Yeah, they're gonna put compromise on the lungs, yep. Due to
People
their,
who work at
people
like
who
the
probably work-
factories.
yeah, good, Julie. Those are who are factory workers. Who else are we worrying about with our respiratory needs when they're older?
My Nana had tuberculosis when she was younger and she developed COPD.
Mhm. And TB was not that uncommon, not too long ago. We look at another COPD group that we think about with our, it starts with a P.
Pneumonia.
No, these people are around it. I hope it's not. being sprayed in my house.
Pesticides?
Yeah, pesticides. We're gonna think about our pesticides and we're exposed to all that stuff, right? Okay, keep on going. We look at our depression and our grief. Remember, there's loss at this age. We have our nutrition. We want to keep them so that they're eating. What are some things we look at in the house with our home nursing for old people?
Refrigerators.
Expiration
Rugs.
dates. Rugs for sure. What other things are we gonna look at?
The knobs on the stoves to make sure that the color's offset enough to where they can see it, like having red on black rather than gray on black.
That's a good one.
The temperature in the
else?
fridge.
Definitely temperature, good.
The water heater settings to make sure it's not above 120 degrees.
Yeah, we're gonna watch our water heaters. We're also gonna watch our vents, right? To make sure that they have heat when they need it, they have air conditioning when they need it, right? Because the last thing you want is for an older person to be overheating in their apartment. Okay. Safety, we always think about that. They have a lot of drugs that they're taking. We look at, and oftentimes we'll see in older homes and communities, we're gonna see a lot of clutter because they've been collecting things for, 80 years and now it's all over everywhere. We're gonna look at our drugs every visit. Make sure someone spoke about that. And with our older community, we worry about abuse as well, right? Because we see there's a rise in that. All right, faith in hospice nursing, death and dying. What do we know is our goal as a hospice nurse?
To
Promote
provide comfort.
Yeah, comfort, what else?
Pain relief.
Could be. Starts with a D. We're gonna make sure we are providing them with dignity, correct? Yeah, we're gonna make sure we do that at this time in their lives, and we are giving special consideration to families and how are they processing? Is this creating a family crisis, right? Review for me, please, your bioterrorism, your radiation, your pandemics, and your natural disasters. These are going to be, how do we cope with them? And once we have an outbreak, what are some things we're going to do? Who do we worry about in the outbreaks?
Immunocompromised.
Of course. Who else?
Elderly.
Keep going.
Babies.
Keep going.
Immunocompromised.
Go for it. Everybody is who we worry about, right? We worry about everybody, nurses included in this. Oftentimes nurses in disasters are in their own home going through the disaster. So we worry about everybody. When we're doing our disaster triage, we're going to do our ABCs. Usually, most of the time, we're always going to be worrying about that guy that's bleeding out because that's a life-threatening injury, right? Chest wounds, like a burn, 2 to 3 degree burn, 2nd to 3rd degree burn. An abdominal wound, eye wounds is going to be a little more stable sometimes. And then we have our minor ones where we're going to put that on the back burner until we take care of our primaries. Migrant workers, we just talked about this. What are they very vulnerable for?
Pesticide
Just
exposure.
like poisoning, back pain.
Yep. And what else? Look at the second picture at the top there.
Close quarters.
What do we know in close quarter?
Tuberculosis.
Meningitis.
Meningitis, tuberculosis, yep, both of those. We're gonna see TB in our migrant workers too, and that's gonna spread like wildfire. Where else do we see TB?
Jails.
Yep.
Homeless?
Yep. Homeless in jails, yep, good. What else can we talk about? Our rural communities, we have a decrease in leisure activities. We know that not everything is shared. They hide a lot because they think everybody knows something. We have long work days in our rural communities. So things to remember. We're going to help them get places because they may have a hospital that's very far away. So we're going to help them. That doesn't mean us as nurses is going to drive them there, but it does mean that we're going to look at the resources in the community. Okay. And maybe there's somebody that works at the church that can help drive them. Okay. Most important thing for us as community nurses is we are advocating for the patients and trying to get them to the safest, most healthy place they can be. When we look at substance abuse, we talked about this a little bit. Primary, secondary, and tertiary, there are some examples. Who can be abused? Who can abuse is really the question. Who can abuse?
Anyone?
Everyone.
Mental
Everybody.
illness. Yeah.
Yep. We're not going to usually see our pediatric population, but if the parents are overdosing them, certainly can create some concern there. Who is at risk?
For substance abuse, homeless people,
Yep. Who else?
Adolescents.
teenagers, yeah.
Elderly.
Poverty.
What kind of things do we know? There is a genetic component, don't we know that? With substance abuse. So we see that in families, right? We see an overlap there. Be careful with alcohol. Oh, that's terrible spelling. But alcohol and our vitamins, right? Or our supplements, whatever we're taking. We see our vaping and smoking increase among our substance abuse. Homelessness, we've talked about quite a bit. I'm not going to really do a whole bunch here. Here's our cycle of abuse. What we're going to be doing with our elderly, if we see these signs, depression, confusion, isolation, unexplained bruises and burns, dirty, underfed, bed sores, changes in banking or spending, right? And then we're going to, with our kids, we're going to talk to parents about developmental phases, about crying. What happens with crying? What is this something that we talked about happens? This was a question on your test, but what is that age group that's really vulnerable to abuse?
What, 1 year old?
1 year old when they're not able to communicate just yet.
Yeah, and all they do is cry, right? And so we think about shaken baby syndrome, which usually happens earlier than that, but under the age of 1. All right, effective discipline. A lot of parents don't know how to discipline, so they hit because that's all they know how to do. But there's other ways to discipline children, and we as nurses can teach them that. And we're coming to the end of our PowerPoint slide. Culture, cultural sensitivity, time orientation, faith foods. We know we have to be sensitive. Are we all culturally competent in this class?
No.
Absolutely not. We're continuously revising and learning and figuring things out, right? And we need to be very careful of our own biases and our own traditions. Our Native Americans, we know, what do we do with them? What is true about them?
They're not time oriented.
Mhm. And if you look there, cancer is the leading cause of death for them. Okay. There's a lack of detection going on, secondary prevention in our Native Americans. So that's something as nurses we can improve upon. We also see a ton of abuse in this when they're on what's that called? On the reservations, right? We see abuse on those reservations because there's nowhere for the women that they feel to go. All right, there's my references, but anyway. Okay, any questions on the PowerPoint? I know this is kind of dry. I'm trying to get everybody involved, but nobody wants to talk. So Roxana, thank you. And thank you for the ladies that contributed. But all right, we are going to take a look at an Excel spreadsheet. What this Excel spreadsheet tells us is some main topics. Okay. And so I'm going to just randomly call on people. Here, let me take attendance real quick before I do that. I'm going to randomly call on people. So I hope everybody's not sleeping. Esther, you're here. Thank you. Ashley, you're here. Oh, I saw you. Asada, you here? Yeah, there you are.
Here.
Roxy, you're here. Brittany's here. Thank you. Raphael's here. Maya. Martha's here. Yes?
Yes.
I thought I saw you somewhere. Matthew, you're here, right?
I am.
Angela's here. Michelle is here. Julie's here. Carissa, you here?
Yes.
Oh, you're so quiet. All right. Yesenia is here. I saw her. Alejandra's here. April, you're here, right?
Yes, ma'am.
Tatiana's here. Anna's here. Amodi, you're here. And Paola. Andrea, are you here? You are here.
Yes, I'm here.
Good job. And Jenny, I saw you. Okay, good. All right. Any questions so far? You guys want to do a Kahoot and then we'll look at the Excel? All right. That'll get everybody. Oh, good. Calendly? I'm gonna write that one down. Somebody just told me another calendar thing. Okay, let's do a Kahoot and let me see which one. You guys want to do primary, secondary, tertiary prevention? Do you want to do one for the second half of the quarter? Second half of the quarter?
Second half.
Yeah, I figured. Okay, hold on. I'm gonna open it right now. All right, it's loading for us, which is always nice. And here is our pin. 909-755. I know we usually take a break right about now, but I feel like if we just barrel through, we might be able to get done a little early. Is everybody okay with that? If you have to step away and just go to the bathroom or get something to drink, that's fine. Just make sure you come back. All right, here we go. Your first question is going to be multiple choice, but it's going to be select all that apply. Epidemiological surveillance is which of the following? All right, we're all over the board here, but that's good. We know we have 2 surveillance systems, passive and active. It's always good. We're always going to be looking for the trends. That's always going to be your answer, looking for patterns and trends. We know that there should be an action that we do from it. Diseases are reportable by our healthcare providers, which is going to be our passive when they report to us. And then we provide information for public health action. This I'm going to skip. We talked about harm reduction a little bit, but which one is a form of harm reduction? It's select all that apply in this one. All right, we got them almost all right there. Why would punishment approach not be a form of harm reduction?
That was only legal when I was growing up. Just kidding. It's not.
You're right. Well, you are right on that one. But punishment is not going to be a way we reduce our harm reduction, right? Punishing someone is, we know, even for kids, is not particularly effective. It has to be very, very coordinated and very careful. And so that's never going to, we're not going to ever use our punishment as nurses, right? Healthy People 2030 is multi-select here. So this one was a little tricky because I don't know that we discussed that it was part of our Department of Health and Human Services, but it is. And very good. Our goal is to improve our health and eliminate our health disparities. All right, let's see here. Healthy People 2030 objectives provide a framework for primary, secondary, and tertiary here. Ooh, assessment. All right, so most of us pick prevention, and it is going to be, your objectives are always going to be, what can we do to improve what's going on? Not what should we look for, but what are we going to do to improve or prevent our conditions or populations or communities of having something not as positive as what we could do for prevention. All right, another multi-select. We went over this a little bit already. Disaster supply kit. Multi-select, select all that apply here. Ooh, all right, we all knew about our flashlights, good. Medications, remember, you're gonna have extra medications and glasses in there in case you need them. So we got to be able to see. And think about supplies to protect you from natural disasters. There is nothing in this kit that can prevent a natural disaster. What do we know about natural disasters?
They're uncontrollable.
You know, we can't really prevent them per se. They're natural, right? They're not man-made. And then items to help you evacuate. No, I don't know what you would put in there that would help you evacuate. I mean, you're not going to have an extra set of an extra car, a boat, not going to fit in a supply kit, right? So these are why we need those things. items you need to survive. That's what this disaster supplies kit is. What you need to survive there. What is considered a barrier of evidence-based practice? Select all that apply. Good. Across the board, we were pretty close. What is our evidence-based practice? Somebody remind us. What's evidence-based practice? It's not a trick, you guys know. Isn't that when we look at our evidence and we try to change things to improve what? What are we trying to improve?
Client outcome.
Yep, we're trying to get our clients in better shape, right? So what ends up happening a lot of times we'll see is that our nurses are gonna have, oh, why do we have to change this? You see this with like new EMR systems, right? They're like, oh, why do we need a new one? This is dumb and blah, 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 blah. So that lack of willingness to embrace the change, poor leadership, and this is how we've always done it, okay? So those kind of mindsets are gonna really create a problem. Small facilities, no, it can happen anywhere. We'll skip this. We just talked about evidence-based practice. Ooh, this is a good one from our test. What's the dimensions of a community assessment? Select all that apply. Oh my, we're all over the place here. All right, what do you remember about dimensions? What are dimensions of a community?
People, place, and function.
Very good. People, place, and function. So when we're looking here, we're looking at our data sources that look at the people. We're looking at our State Department and welfare agencies, and we're looking at our location or our maps where we look at the place where it is, okay? So this is very specific to our dimensions of a community assessment. What's the purpose of a community health assessment? Select all that apply. Okay, so purpose of a health assessment is to figure out what's going on, right? What are the needs that we need? What information can we find? What can we generate? Our data gathering and our data generating. And where can we look at our people, our place, and our function, right? Our dimension of our community. So a past need is not really going to be a concern when we're doing a community health assessment. We're looking at what we need to prioritize for right now, okay? All right, good work on that. We're going to stop on our Kahoot and let's take a look at our Excel spreadsheet. These are topics that I will tell you have been identified as needing to know on our HESI. So with our community health, we have our vector-borne diseases that we talked about. Our reportable diseases, what are the ones we have to report?
COVID.
COVID, flu.
I don't think you have to report. Do you have to report flu? I don't know.
I know you have to report like STDs and HIV and stuff like that.
Yeah, you do.
TB.
On our endemic symptoms with possible terrorism, we're going to see that impact on our immune system and our blood work. We're going to do drawing on blood and things like that. Anthrax, incubation, we talked about SARS, risk factors for pelvic inflammatory. What are some risk factors? Oh, that's right. I have to call on people because nobody's participating. Hold on. Risk factors. Matthew, what's a risk factor for PID? What's a risk factor for any STD?
Multiple partners not being safe.
Good. Multiple partners we see with PID oftentimes. Good. Epidemiological triangle. We talked about that quite a bit. A flu vaccine. We know this is a priority. And what type of prevention is this? Raphael.
Yes. Primary.
It is.
He's saying yes, yes, primary. Okay. TB skin test follow-up we talked about in our x-rays. We're going to make sure we know that. With our vulnerable populations, our death and dying, right? We talked about nutrition, depression, goal setting. What is our goals going to be focused on? Oh, what are we going to focus on with goal setting?
Safety.
Anybody want to help them out? Not necessarily.
Safety.
Yeah.
Safety.
Yeah, safety. But what do we want the goals to be? Who is going to be? Keep going. What you saying?
Oriented.
Yes, patient oriented. They want to be involved in those goal setting, right? Abuse, we've talked about to nauseam. We are mandated reporters. We are going to report any abuse that we see. When we take a look at our disasters and our red triage, we talked about, remember, our most severe to our least severe. And endemic symptoms that we may see with possible terrorism. What are some things you can think of that may be endemic symptoms? Michelle, what do you think endemic? Might be possible terrorism.
Anthrax.
Anthrax, somebody just said. They whispered this.
Yeah. Anthrax.
What are we going to see with that? Anybody? What are we going to see with anthrax?
Respiratory
Like
symptoms.
nausea, vomiting.
Sores on their skin.
Yes, all of the above. Yep. We're going to see sores, sores. We're going to see respiratory. We're going to see a whole bunch go on with the body system. When we look at our family assistance and with our geriatrics, okay, geriatrics is going to be a big part here. We know that we look at our iMeds and how we can have families. Where are we going to put the iMeds? We're going to put them in the mouth?
No.
In the ear?
Put it in the corner of the eye.
Eye. Does anybody know where in the eye you put them?
Not supposed to do that.
Conjunctival sac.
Hey, you put
Yes.
it.
Yeah, that's correct.
I thought you
Yeah.
were asking like where do they need to be placed, like in the house?
Oh, no,
Yes,
but that's
stores.
good. Where do you think they'd be placed in the house?
I
Medicine
would say
cabinet.
somewhere nearby them. So they're if it's something where they need to see, I guess, like dry eyes, it's somewhere nearby where they first wake up, they can just grab it on the nightstand.
Yeah, and be careful here neurologically. If you put eye drops near someone who's neurologically compromised, what might they do with them?
Put them in their mouth. Lose it.
Eat it, drop it in their drink, right? If we worry about our neurocompromised here. Teaching with our lead poisoning, we talked about the year and its prevalence. As you see, a lot of the topics we covered in our PowerPoint, this is just kind of a review for us at this point. When we look at leadership, we're looking at our morbidity. We are always gathering data. Okay, we're always trying to find out what's going on. What are we looking for? There's two words I said, remember, we're always looking for these. Trends and patterns, trends and patterns. Remember, we're always looking for those things as community health nurses. Primary prevention with cancers. We're going to be teaching to all age groups about this. Okay. And then when we look at infectious disease, I'm not going to spend a ton of time on this because we did go over most of it. We went over vertical transmission with our newborns. We know our STD. We have our vector-borne diseases, like we talked about, our Lyme's, our CDC reportable diseases. We have our endemic symptoms. Again, we see possible terrorism, anthrax incubation, and SARS. Our pelvic inflammatory or epidemic. Oh, this is a repeat. Okay, well, anyway, so I covered most of the topics on here in the PowerPoint, and we did some in the Kahoot. So I'm going to stop sharing at this point. What I am going to share with you guys is this will call the end of our HESI review. What you guys can do at this point, if you have any questions that you think are good for the whole group, go ahead and ask them. If you have questions that are individual to yourself, just hang on and stay with me. We're ending class a little early tonight because I feel like all the material was covered. We didn't take a break. So that's where we stand. I will be sending this recording. I will be posting it for you guys. So you'll be able to watch it again and listen to me again. Sorry, but it's a good review for you. Okay. And
Thank you
Plex,
so
thank you,
much.
Brittany.
So
for
this
showing
book,
us. No,
what, not this one?
no. Does anybody have their NCLEX review book close?
I have an orange one and this one, but neither of them have community in them.
Yeah, we don't have
No,
community.
there's another one. It's like blue and green. It's like a combination. Anna, do you have it? She just got up, so I'm hoping she's going to find it.
I don't think we got, those were the only two NCLEX we had. I think the blue and green one was the older one.
There's this one. Yeah, we've got like the older one.
Anna, that has community in it, doesn't it? I'm pretty sure that one does. The one she has. So if your version of your NCLEX book doesn't have it in there, and you want some practice, you guys can Google NCLEX questions. I mean, in community, there's some.
What was
HESI
the book
examples.
she showed? I'm sorry.
It's okay, Tatiana. Anna showed the book again.
No, it looks like it has like psychological needs, safe in a care environment.
Yeah,
health
Andrea's showing
promotion.
it. Thank you. Yeah, so it does. Good. Yep, Raphael, that's it. Everybody see the book?
No, I haven't been. Oh, okay. I got it.
See it?
I have this one.
Yeah, that's it, Roxana. Okay, so that's just a recommendation. Don't commit all your time to that book. Just a way for you to get some questions and to see how you're doing with the content. If you guys have done well up to this point, this class has done very well. So I feel confident with you guys going into HESI. I think you're going to do just fine. What I want you guys to do is review our study guides, review that HESI study guide, but it's 50 something pages. I mean, I don't know how much content you're going to retain. So use it as a reference when you have nothing else to do, but you know, try to do that. Any other questions related to HESI or what's happening? Week 12, please set up the appointments. I'm going to figure out tonight how to do a calendar first thing in the morning. So keep an eye out for an email. Everybody has to sign up or you won't get credit.
This is our last class, right?
As far as I know.
Because next
think
week
so.
we have the
HESI.
HESI, and then on the last week we are meeting with you one-to-one or something like that.
Yeah, exactly.
Okay.
But it'll be during our class time for the most part. So don't commit to anything on that, you know, Wednesday, 2 weeks from Wednesday. If you can't meet with me Wednesday, don't worry about it. We'll find another day, but I'm going to send out a calendar, 10-minute
Is it
slots.
Tuesday or Wednesday?
It is Tuesday or Wednesday. What I will tell you is my Tuesday class is filled up a lot of the time,
Oh, I see. Okay.
but no worries. I'll work with everybody for what works with you guys. Okay.
Okay.
It's
So
just
I'm
really
with
for us
mine,
to
right?
catch up.
Should I just send you an email like
Yeah.
saying?
Yeah, that's fine.
Okay, thank you.
Mhm.
Thank you so much.
I'll try to get a shared calendar as well, and then I'll send that out too. But if you want to just email me, that's fine. All grades will be in. Assignments will get turned on after the HESI. Remember, we need a 78% on our graded assessment. So exam 1, 2, 3, and HESI need to average out to a 78 for anything else to count.
I've got a quick question too.
Yep.
For the HESI, typically we can go in and we can put in the grade just to see kind of a rough estimate of what we need to make on the HESI.
Mhm.
But I don't see that on our grades where I can put the number in to see. Has that?
All right, I'm gonna switch something right now. Matthew, tell me if you can if I switch something, okay? Do it while we're on camera so that everybody knows this.
just because I like to have kind of a worst
Yeah,
case
I
scenario.
understand. And we're at the end here, guys, so. All right, see if you can put a grade in now.
Yeah.
Okay,
There it is. Yeah, okay,
yeah,
I got it.
okay. Thank you for letting me know. I don't always times do that, but it's a
I-
good way to know, just to like guess, where do I need to be at?
Yeah.
Okay. So I wish everybody the best of luck on your HESI. I think you guys are gonna do completely fine. I think as long as you're strong going into your HESI, you guys will be successful. I look forward to having you as colleagues down the road. So in peace, and thank you for a good class. I will see you guys week 12. Best of luck on your HESI.
Thank you so much.
Arturius Aloni.
Thank you, Professor. It was a pleasure having
Thank you.
you this semester.
Hey, Professor Aloni.
Thank you.
I took this class last term, and when I went in to sign up for my HESI, nothing shows up in there for me.
All right, so contact your dean.
Okay, the online
may
one or
have-
the one in school?
No, the school one.
Okay, I'll let her know.
Okay,
All right, thank you.
you're welcome. Good night.
Night.
Jenny, can you stay on with me? Oh, she just dropped off.
I just wait. I have a question.
Yeah, no worries. I'll put you in a breakout room, okay? Hey, Ola, you need something? Okay. Go ahead, Raphael.
I missed a discussion like a couple weeks ago. Would that affect me in any ways? Can I do something about it? Like, I don't know.
You didn't do your discussion. Did you do your vulnerable population?
I did. Yeah,
You
yeah.
did? I don't know why you're coming up in my head that you didn't do it. You had,
Yeah.
did I grade it?
Yeah, I got a 50 something.
Okay.
It was about homeless.
Yeah.
Did a PowerPoint.
Yeah, I do remember. Sorry. Your discussion is what you're asking me about. That you didn't do.
Yeah.
At this point, I think it's too late in the game. You know what I mean? Because we're several weeks out. That was
Mhm.
like the middle of the semester. So what I would do is you're going into the HESI really strong. So feel confident in that. If we come down to it and it's going to, if it's life changing, that assignment, we'll have a conversation again.
Okay. No, I have now. I don't think so.
I don't think it should, but you never know. That's why the assignments, until they get turned on, you don't know how much they weigh in, but you're going in really strong, so I think you'll be okay.
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 Thank you. Thank you for
All
everything.
right. Of course. Good night.